So hi all, hopefully you can all see and hear us. I'm delighted to be joined by Nuris. Nuris, do you want to introduce yourself and tell the people watching live at home who you are and what you do?
Yes, I'm a dermatologist and based in Aruba, in an island, sunny island. And we do most everything what the covered dermatologist, skin and hair and nails. And of course we're here trying to help people with psoriasis.
And anything in particular that brings you to EADV, or anything you've seen that you want to share that you think is sort of particularly stand out?
Well, yes, I'm particularly interested in psoriasis. Indeed, I have learned that there are many new treatments, and that's important because for the patient to know that there's hope and there's long-term treatment and good result, and that's what we are looking for.
Yeah, brilliant. And how important do you think it is for, like you mentioned hope there, and it was something I talked about myself at the same conference, that patients knowing what the plan is for them or what the next steps is, how important is that from your point of view?
Yes, of course, the disease, when patients get the disease or the disease appears in any age, is most of the time it impairs the quality of life, and it's very disturbing, and especially if it's young people who are in their development ages, where it's very important for the images. And that's something we really address, and sometimes you have to help the patient psychologically and give the understanding that there are treatments, and the treatments are most of the time long-term treatments.
And that sort of engagement as well, you're more likely to get adherence and everything, aren't you, if they understand all of that. So yeah, thank you for sharing that. So what we do here, in case you're not aware, with VIVPA Ireland, is that we're sort of trying to build a community, a space where people can share their experiences and feel supported, where maybe they don't feel like they fit into an in-person group or a Facebook group or whatever. From your sort of professional perspective, what do you think the importance is of patients that are both well informed but also got a space to sort of meet others, I suppose?
Well, yes, actually what the patients are looking for is, like you said, community support, and some of them wants to be in like others. Like I said, we want a normal life. It's what people want, and yes, I think if you have support in a group, you can go from that group to a normal life, because that will give you more confidence, more insurance that what you have is something that can be normal.
And how have you? Because there's been lots of talk here this week about that sort of informed patient, personalised care, holistic approach. Are you seeing things improve with that in terms of the movement towards that more sort of that partnership between patient and doctor, a dermatologist, I suppose?
Yeah, I mean, if you have your own doctor, you have to have confidence in the doctor, and if you follow treatments most of the time, your doctor is going to, look for the best for you in order to give you a relief. And I think that's important. You have the assurance that the doctor is going to help you.
Yeah, brilliant. And I suppose I'm conscious you're probably a very busy woman, so
Yes.
If you had a message or something, because we have a lot of patients who watch this, or any advice around those sort of themes we've been talking about, what would that be?
It's kind
Just to
kind
put
of
you on the
difficult.
spot.
Yes, I can see that. Yes, I think that most important is to believe in yourself.
Yeah.
And believe that you can do it, and that it's gonna be good.
Yeah.
I just don't think that we have to close ourselves and separate ourselves from the rest, but try to include ourselves into the whole society.
Yeah, and that helps people get away from that whole just saying I'm fine, or maybe not linking their physical condition with their mental health and all those sort of important themes as well. Yeah, brilliant. thank you ever so much for taking time out of your busy day and joining us. I really appreciate it. I'm sure I can see lots of chat messages there. I'll go back and read them.
Yes, I can imagine.
Yeah, and yeah, thank you for joining us, and I hope
welcome.
you enjoy the rest of your congress.
Thank you.
Thank you.
Bye.